Dr. Shaia of OrthoVirginia, and I'm an orthopedic surgeon who specializes in joint replacement and sports medicine. Oftentimes patients come to me and are complaining of symptoms that are related to hip arthritis. Those symptoms are not always obvious that they're coming from hip arthritis. Hip arthritis is essentially when the ball and socket start to lose that normal smooth cushion that creates friction-free, painless motion. Oftentimes patients will come into my office and begin to complain of groin pain or pain in that crease where their leg meets their pelvis. They'll complain of difficulty getting up and down stairs or getting out of a car, getting up from a seated position, morning stiffness in the groin and hip area. And when the arthritis or the wearing out of that cushion begins to advance, they'll begin to have pain with simple activities like walking. So oftentimes when a patient first comes in and is diagnosed with hip arthritis, hip replacement is not the treatment of choice. We like to begin with more conservative treatments, such as activity modification, medications to reduce inflammation, which is often the source of pain from arthritis. And when we talk about activity modification, we're talking about avoiding high impact cutting and twisting type activities. Patients who have a risk for developing arthritis or who have been diagnosed with early arthritis will benefit from cardiovascular exercise that is low impact or no impact. So we focus on things like walking, swimming, cycling, elliptical, and things of that nature. By focusing more on those type of activities for cardiovascular exercise, we minimize the impact on the patient's hip arthritis and minimize the speed with which that arthritis might progress. So for many patients, after a period of time, simple things like anti-inflammatory medications and activity modification will not be enough to avoid the pain of arthritis. As arthritis advances, as that cushion wears out more and more, treatment options need to become more invasive in order to relieve patients' pain and to help them maintain an active lifestyle. That's when we begin to talk about hip replacement. Hip replacement is a procedure that we do to remove all of the arthritis of the hip joint and replace the hip joint with an artificial joint. So hip replacement is a procedure where patients come into the hospital on the day of their surgery, and we surgically remove the arthritic ball and the arthritic socket of the hip, and we replace the ball of the hip with a metal stem that goes down into the thigh bone and has a metal ball that attaches to it. On the socket side, we replace the arthritic socket with a metal shell that has a plastic liner that fits into it, and that makes up a total hip arthroplasty or a hip replacement. Patients usually do very well during their hip surgery and stay in the hospital for a day or two afterward. When they come home, they need a little extra help in their home for the first couple of days to a week or so. And within a couple of months, most patients are back to their regular routine, walking for exercise or doing those no-impact activities like we talked about, cycling, elliptical, and things of that nature.